Good evening, everyone. My name is Donna Watridge. I'm the Chief Nursing Officer for both Newton and Hackettstown Medical Centers here in Northwest New Jersey in the United States of America. I'm here to talk to you this afternoon about engaging a workforce utilizing an all-in approach. And I'm so excited to be with all of you this evening. I wish I was there in Prague with every single one of you, enjoying the beautiful weather and the environment there. We have no disclosures to disclose, but I wanted to start the presentation talking to you a little bit about where we are on Earth and in the United States. So for those of you who live in the US, I am from New Jersey, born and raised in New Jersey. I'm sure you can all hear my Jersey accent. And we are in Northwest New Jersey. We are about 60 miles from New York City. We are about 20 miles from the Pennsylvania border. We are off Interstate Route 80, for those of you who know Route 80. And our two hospitals were two small community hospitals, and I'll go into a little bit more of those statistics in a little bit. And those hospitals are about 17 miles apart. And depending on how fast you drive and who you are in the state of New Jersey, it can take you anywhere from about 22 to 40 minutes to get between the two sites. Here is a picture, a blown up picture of about where we are in Northwest New Jersey. We are shaded in the purple in the upper western corner. We also have, we look at patients that come to us from Pike County, Pennsylvania, as well as from New York State. So we do have a large geographic representation. Here's the entire state. We are part of a 6-hospital system, and it's growing as we speak. We are a mid-sized integrated healthcare system located in northern New Jersey, and we do represent 11 counties in the state and cover a number of different patients. Newton and Hackettstown Medical Centers are two small community hospitals. Newton is slightly larger than Hackettstown Medical Center. We do have some different services that are offered here. We have 148 licensed beds. We have about 1,200 team members. We do about 8,000 admissions a year. We do have a maternity program here that sets us apart from Hackettstown. And we also have a inpatient behavioral health program with a 16-bed inpatient unit with 6 STCF beds. So we're the only Atlantic Health site with involuntary and STCF beds in Atlantic Health, which makes us a little bit unique. Hackettstown is slightly smaller. We are licensed for 111 beds, and we occupy about, at times, 95 of those beds. So we don't use all of our licensed beds. We have about 700 team members. We do about 23,000 ED visits and have about 3,700 admissions. So it gives you an idea of about scale and size and scope of where we are. We are very, very, very proud of the awards and recognitions, and you'll see a lot of those on the screen in front of you with the different areas of where we are proud with Healthgrades, U.S. News and World Report, as well as Leapfrog. We are most proud of our pathway journey. We were both designated as pathway sites in last year, in February of last year. We petitioned to ANCC to do it as a region. So Newton got its redesignation, and it was the first time Hackettstown was designated. Every Atlantic Health site does have an ANCC designation. And earlier this month in June, we did submit our document submission to Magnet for Newton Medical Center. So we are very much on the Magnet journey at Newton and well on our way at Hackettstown. In front of you, you have our professional practice model. None of this would be possible without our professional practice model. You see that we have hands that are holding a flower. Each petal of the flower represents quality and teamwork and a leadership quality that really drives us to give outstanding, safe, patient, and effective care. The team that put this together is in front of you, and this is just a small sample of the team members. But really what's really important about this picture is that this is a multidisciplinary team. This is a team that includes leaders. This is a team that includes bedside nurses, and from a variety of different disciplines. From myself to the president of the hospital, from human resources, who's been an integral part in every single one of this. We have a great collaboration with HR, to our directors of nursing and nurse leaders from the variety of different subspecialties and specialties, including inpatient and outpatient and ambulatory surgery in the operating rooms in the emergency department. We have our clinical nurse and nurse researcher on here, and really an expansive team of bedside nurses. So proud of everyone who put all of this together. Let's talk about what we did and why we did it, because I think that's why we're here today, and it's so exciting for me to share this news with you. So our journey started back in about 2022, and we complete an annual team member engagement and culture of safety survey. We've been doing these surveys for a number of years. We chose this one as an initial baseline survey. As you all are well aware, this was also in the middle of COVID. And so it was a great opportunity for us to take advantage of the changing dynamic and the environment that we were in. We wanted to make sure that we had a better representation of our teams and improve our national percentile ranking. So we reviewed the literature, we looked at the employee engagement survey, we reviewed the data, we reviewed our written comments from the survey, and it was very much consistent with the literature. And we sat and thought, and we identified that there were some gaps. And what we determined was that how are we going to tackle improving our culture of safety and team member engagement survey? And we decided that we were going to go after this full force and by addressing leader engagement, that the best way to engage the team was really to have an engaged leadership team. So we started on that journey. So one of the very first things we did was conduct a leadership survey separate from the engagement and culture of safety survey. And together we reviewed those results and created an action plan. So what were the themes of this leadership survey? Well, there were a number of themes that came out from the leadership survey. As I talked about earlier, I had said that we are two small community hospitals in the northwest part of New Jersey, and we are, it's about 30 minutes to get between each site. And what happened was the team was telling us they wanted the senior team to be more visible. And we needed to find who the senior team was. Many of our team members thought the senior team was just myself, the president, and the chief financial officer. So we were on a campaign to educate the entire team of who we all were. So we started from orientation, put our picture up, and really talked about who we all were, what our roles and our scopes were, because we do most of us cross both campuses. We do have nursing leadership that is dedicated to the sites, but we wanted to make sure that everyone was educated on who the senior team was. But we found that there were still more opportunities. They wanted leadership. They wanted more feedback from leadership. They wanted the senior team to be more present at each of the sites every single day and have set schedules. The leaders wanted us to focus on both what was positively going on in the organization, not just all of our opportunities. They wanted to have more special events, particularly around leadership development opportunities, and so that the entire leadership team could come together. They wanted mentoring opportunities. We heard that loud and clear that there was a lot of opportunities for mentorship, and we do a lot of rounding. We'll talk a little bit about the seeds of what we do and the things that we do here in our organization. We do a lot of rounding. We serve a lot of food for a variety of different occasions, but the team wanted rounding with purpose and intention, and we'll talk a little bit about what that is. So what did we do? We said earlier, it's all about engagement and how do we engage our leaders. I spoke earlier about some of the seeds of what we have done. These seeds were efforts that we had done in the past, and they were kind of the foundation for what we built upon moving forward. We then took those seeds, developed an action plan, involved the culture of innovation, really focusing on the leadership focus that enabled us to move forward and build upon the work that we had started. Let's talk about what we had done when we talk about seeds. So we planted some of these seeds and we watered them and let the sun at them, and we really had some great participation. So we had a reward and recognition committee. Then we did Cheers for Peers. Each side has Cheers for Peers, where we celebrate team members as a team members as individuals. There's a patient experience award. There's a patient safety award for high reliability, for awards for our safety coaches. We really use this as an opportunity, and we invite family members to come into those team members. We also encourage patients and family members who have wrote those nominations to come in and celebrate. We give out free ice cream, and we really do a big hoopla for Cheers for Peers. It's quite an event. We'd celebrate monthly birthdays with a cupcake celebration. We have hot chocolate days. We did a night caricature. One of our team members had a caricature at her wedding, and it was really a big hit on the night shift. We were in the front lobby, and we had an artist spent hours, and we had the line of team members, and it took about 2.5 minutes for the artist to do a caricature of each team member. The artist did take pictures, and they did a rendition off the picture, and it really was very personal. We got to get to know a lot of the night team, and they really were, it was a well represented event. We also heard that people wanted things to be done around the clock and around year-round visibility. So we do patient experience rounding, and we had pumpkin contests, just to name a few things. So we took all of these different activities, which were our foundation for what we had done, and we said, this is what we do. How do we take this and then build upon it so that it really has some meaningful use? We had HR business partner listening sessions. So the HR business partners went to different departments, such as the ICU, to engage them and to do different things for what we were doing. We did engagement survey feedback sessions. We had posters where we put Post-it notes up and people wrote their feedback on it. And we did pulse surveys. We tried to engage the team in different shifts and on different days of the week to really listen to what they were saying. And we had the senior team partnership. The senior team was paired with leaders in the organization, different service line leaders, to really round with them so that we had a robust culture of leadership development. Our culture of innovation was, we hired a consultant, we hired the Aegis Group, and we focused on our engagement indicators. We looked at our engagement indicators from 2022, and from there, we developed 6 leadership teams that were focused on small, medium, and long-term goals. We talked earlier about our shared governance structure, and from our shared governance structure, we had the human subcommittee off of the managed PCMC, Patient Care Management Council, and that off of our management council, we have the human subcommittee. They came up and with the leadership survey and then distribute that out to all of the leaders for which we got the feedback from. The senior team took ownership of the survey results and really came up with a number of themes. Here we have the key drivers and the themes that we had. We had 6 teams. They were, again, multidisciplinary teams. You can see the teams. We all came up with a team theme. We did videos and had songs. It was really very, very engaging. And we tackled projects based on the themes of what had come out in the engagement survey. One was how to build an effective meeting. The other was how to increase reporting. Many of you have incident reporting systems, and we wanted to make sure that we were capturing all the data for the incident reporting systems and not just addressing serious preventable events, but really trying to get to the precursor events. We're all sitting here and getting emails as they continue to build up, managing the volume of emails and the timing of emails. So we had a team dedicated to that. We wanted to continue to build upon the robust reward and recognition committee. And we established a team buddy system where we had new leaders coming into the organization and who were matched up with another leader, not necessarily in the same discipline, but it was more than just checking a box on a checklist and really walking them around the 2 sites to really engage them and to introduce them into the culture of the Western region. And we had a Western region bonding events through a bunch of different volunteering events. We donated backpacks. We had all kinds of fun. This is just one of the examples that we had done from the Reward and Recognition Committee. We did a Family Fun Day. We had over 500 family members come to a local farm in Northwest New Jersey. We had hay rides that were free. We had gave out free pumpkins and free ice cream to the kids. And there were food trucks for people. And really, it was an incredible evening. 500 people came out. It was just awesome. Another event that we do is the turkey toss. Team members have the opportunity to choose. It typically in late August, the organization sends out an email and you can choose a turkey, a ham, an apple pie, fruit basket, or donate your item. The team members then drive up to pick their requested items. It's just awesome. We created message maps describing the structure for how we address our teams. We partnered with Press Ganey, who administered the survey based on anonymous survey responses. Each department is categorized as Team Index 1, high performing team, Team Index 2, moderate, Team Index 3, low performing team. This is just an example of a message map that we used for a communication tool at one of our ICUs. So how did we do with all of this great results? We increased our number of responses by 31% combined at the two sites. You can see that year over year. You can see that we increased our percentile ranking 56%. The Newton Tier 1 increased by 75%, and the Hackettstown Tier 1 increased by 18%. So really some incredible shifting with what we had done, some incredible results. The project was conducted at the two small community hospitals. The baseline data was completed in the fall of 2022, and we yield a 71% overall participation rate in the 41st percentile. Post-implementation, the data yield about 1,500 team members completed the survey with 84% participation rate. We were with some of the two highest hospitals in the organization with the highest participation rate, which was incredible, and with the 64th percentile ranking. So we achieved some incredible results. Team member response rate increased 31%, which yielded clinical significance. The project was fiscally responsible and could easily be replicated. The limitations of the study included some of our designs, and occurring at the two community hospitals limits our generalizability. Continue the discussion. The positive outcomes from this intervention could be the basis for future studies. We are looking at continuing to evaluate the data to see how well we can do and to take it to the next step. The interdisciplinary healthcare leaders from the bedside to corporate operationalizing a process to engage team members and act on feedback is essential to engagement and foster a healthy work environment. It really was a great opportunity to engage all of the team members. Here are our references, and I'm happy to answer any questions for you that you may have. It has been a pleasure to meet with you this afternoon. Have a great evening.